Hey everyone, my name is Heather Andrews, and this is my presentation for my integrated trauma treatment. For this presentation, I will be talking about how eye movement desensitization and reprocessing, along with art therapy, can be used to treat post-traumatic stress disorder, also including components of internal family systems. Hey everyone, my name is Heather Andrews, and this is my presentation for my integrated trauma treatment. For this presentation, I will be talking about how eye movement desensitization and reprocessing, along with art therapy, can be used to treat post-traumatic stress disorder, also including components of internal family systems. Criteria E is marked by alterations in arousal and reactivity associated with the traumatic event, beginning or worsening after the event, and must be evidenced by two or more of the following: irritable behavior and angry outburst, typically verbal, physical, or physical aggression towards people, reckless or destructive behavior, hypervigilance, exaggerated startle response, or problems with concentration. Criteria F is simply that these above symptoms must have been present for more than 1 month following the event. Criteria G states that there should be significant and disturbance in social, occupational, or other functioning due to the event, and criteria H says that it is not caused by another substance or disorder. Next, we will take a look at how trauma affects the brain. This slide talks about the 4 parts of the limbic system. The hypothalamus is responsible for producing hormones, sleeping, blood pressure, body temperature, sexual functions, hunger, thirst, and mood. The amygdala is where you feel and react to things and controls your emotions. It also helps with memory and social interpretations. This is where the reactions come when fear is sensed. The thalamus is responsible for your senses and emotions as well. The hippocampus is where you form new memories. The amygdala is the center of the emotion regulation. It does the emotion regulation and fear conditioning. It also helps with memory formation, and emotionally charged memories are found through the amygdala. When stimulated, it is also responsible for aggression and behavior issues that stem from the fear or the memories. The amygdala is known as the fear center of the brain. It initiates the physiological responses of fear and anxiety. This leads to the fight or flight responses to be initiated. The stress responses are also produced through the amygdala as well. The sympathetic nervous system is responsible for the fight or flight response. Once danger is detected in the brain, the hypothalamus releases a chemical called corticotropin. This then awakens the pituitary gland that triggers the adrenal gland and then releases adrenaline, which is known as the stress response hormone. This then prepares the body for fighting, increasing heart rate and blood flow to vital organs. This fight response is what gives you strength or ability to do things in the moment that you would not normally do. It can make children as strong as adults, or sometimes stronger. The same system can also tell that it is better to flee and to run instead of fight. Uhirnik 2017 notes how the parasympathetic nervous system takes over during the freeze response. It shuts down all functions of the sympathetic nervous system, and the body's neurological functioning shuts down as well. This can lead to fainting, forgetting what is happening, dissociating, and even blacking out during the moment. This is considered a hypoarousal state, where the body has slowed movements and responses to things going on around them. Now we will take a look at internal family systems therapy. This is the therapy approach that I have chose to be rooted into my other 2 therapy treatments for someone with post-traumatic stress disorder. Internal family systems therapy was designed by Richard Schwartz. He believed that the psyche is comprised of many parts that interact with the individual. These parts often conflict one another and can be extreme or rigid. These parts also tend to be considered many personalities or subpersonalities that we have within our own mind. IFS works to balance, understand, and integrate these parts to be harmonious. there are different parts that are pulled out and categorized as a part of internal family systems. These parts are the exiles, protectors, and the true self. When doing internal family systems therapy, there are 3 core principles to note. The first is non-pathological multiplicity of the mind. This means that there's a multifaceted collection of parts, with each have their own desires and perspectives and roles. So all of the parts that are pulled out and personified here have their own desires and perspectives and roles that they play in helping protect or control the individual. Systems theory is the second core principle, which is the interconnected parts form a whole. Changes in one part affect the whole. The parts are not isolated. So if one part of the system is suffering, it can affect how the other parts are interacting and reacting as well. And finally, the third core principle is the self. The self is non-judgmental. It has curiosity, compassion, and clarity that exists within the individual. Ultimately, the idea of internal family systems is to bring out the self and to control the managers, the firefighters, and the exiles from taking over. As mentioned previously, the different parts are mainly divided into 2 categories, exiles and protectors. The exiles are the ones that carry the painful emotions and memories that have been shamed, disowned, rejected, or hidden that are created in response to a traumatic event. Often these exile parts are pushed away to protect from pain and discomfort that they cause when they come up. The protectors are the defense mechanisms that help to protect from the pain, harm, and vulnerability that come from the exiles. The protectors respond to immediate and intense emotions. They can often include depression, self-isolation, criticism, anger, and addiction. While some of these mechanisms can be harmful to the individual, the parts do help to protect in the only way that they know how. So even though things like addiction and anger and self-isolation can be harmful to the individual, the part is doing what they can to protect them from the exiles and from them taking over. The protectors can then be broken down into 2 different subgroups, managers and firefighters. The managers are more proactive, attempting to avoid negative feelings and experiences before they come up. So these are going to be the ones that are proactive at trying to avoid having these negative emotions and feelings come up at all. Firefighters, on the other hand, are impulsive and react to the situation, oftentimes negatively. Firefighters come in after the negative emotions and experiences have come up, and firefighters try to put them out. Just like a firefighter tries to put out a fire after it has been started. Managers try to keep the fire from being started at all. The self is at the seat of consciousness. The self is what's left after all of the other parts retreat. Ideally, the self will lead the internal system in a mentally healthy individual instead of the other parts. The goal of this therapy system is to increase the self-awareness and the self's ability to lead the individual instead of the managers, firefighters, or exiles leading instead. Now we'll take a little bit of time to discover how IFS therapy works. The more trauma that an individual experiences, the more disconnected to the self that they are. This leads to the exiles becoming more prominent. The parts strengthen as self decreases due to the traumatic experiences. So the worse the traumatic experience, the more the self hides away, and the more the protectors and the exiles are prominent. The therapist and client then work together to befriend the protective parts and acknowledge the role that they play. Again, even though the protectors can be using harmful or negative protective ways for the individual to cope, they are serving a purpose for the individual. It is important for the individual in counseling with their therapist to learn how to Befriend these parts and be thankful for what they have done to protect them, even if it's not necessarily in a good way. These parts can then step back and expose the exiles. When doing this, it allows for you to adopt self-qualities, compassion, self-love, self-acceptance, and allows the self to return as the leader over the parts. We have to expose the exiles and learn to love them as well and give them the treatment that they need in order for ourselves to then come back and be able to take over. Although at first glance, internal family systems seems to not be compatible with a Christian worldview. After all, Swartz, who created it, did consider himself to be an atheist. But if we dig deeper into the principles of what internal family systems does, we can see how it is incorporated into Christian worldview and values. The parts burden the individual much like our sin does. They keep us from being able to have a right relationship and to see clearly God's vision for our life. Much like the parts keep us from being able to see our true self and to let that guide us. The protective factor can often result in sinful actions, such as the addictions or the anger. Being able to restore the self can help lead to acceptance and a closer relationship with God. Putting down these sinful actions that we are doing in response to a traumatic event can allow us to appreciate the traumatic event for what it was. Even though it was horrible, we can learn that there is purpose in it and that God proves a way to find use in it, even through the horrible experience. Next, we will take a look at eye movement desensitization and reprocessing, or commonly known as EMDR. This form of treatment was developed by Dr. Shapiro in 1987. It has been found to be compatible with most and all major orientations of psychotherapy, and it allows for the reprocessing of inadequately processed memories from a traumatic event. It helps the brain to reprocess and store correctly these memories so when they are thought of, they are less harmful and intrusive than they were to begin with. There are 8 different phases of EMDR. A little bit about the history of how EMDR came to be. Shapiro was walking in the park one day and noticed that disturbing thoughts kept coming and going in her mind without any intentional effort. She realized that her eyes were moving back and forth, and then after she thought about the traumatic event with her eyes moving, when the thought came back up later, it would be less disturbing. She realized that she needed to explore this a little bit more, so she got some volunteers who had reoccurring disturbing thoughts and tested it out on them as well to see if the eye movement would also help them to not have distressing thoughts as often when these memories came back. This led to the discovery of EMDR. This is an overview of the 8 phases of EMDR therapy. Phase 1 is patient history, Phase 2 is preparation, 3 is assessment, 4 is desensitization and reprocessing, Phase 5 is installation, Phase 6 is body scanning, Phase 7 is closure, and 8 is reevaluation. We will now take a look at these steps a little bit further. Phase 1 of EMDR is history taking. This is the point of therapy and where rapport building begins. Case conceptualization is also done during this stage. This allows for the therapist to gather the information of the client's history, the traumatic events experienced, and the other important information before beginning therapy. A treatment plan is also done at this stage, which identifies the target memories that need to be reprocessed. Phase 2 of EMDR is preparation and stabilization. Determining client readiness and how it will be administered is a major part. If the client is not ready or does not seem prepared and able to handle the EMDR process, then it will not be successful and can actually be more harmful than good. Determining how it will be administered is determining the bilateral stimulation that will be utilized. There are different ones including taps, buzzers, light bars, and hand movement. A thorough explanation of the process moving forward is also given at this phase. The client needs to be fully prepared for what they are going into and what is going to happen. There is also going to be a stop signal that the client will identify that they can say or use during the process if it becomes too overwhelming or they need to take a break. This is important for their own well-being. Lastly, in this step, the therapist will answer any questions or concerns that the client has about the process moving forward. Phase 3 is the assessment. Assessing the baseline memory is important to determine the starting point of where the individual is going into EMDR. The sensory input and output and the experiences and the level of emotional distress that they cause is determined on a Likert scale by different assessments that are done. These assessments then are utilized throughout the process to determine if the client is making progress with the memory reprocessing. Phases 4 through 6 are desensitization, installation, and body scans. These phases kind of all go together in a session. First, the target memory is reprocessed through the bilateral stimulation and the guidance of the therapist. After the session, the insights, emotional responses, and understanding are assessed, and the results are then processed with, again, that scale that was used earlier at the beginning. Installation and body scans are also used to help the individual come down after the session and feel more relaxed before leaving. This is a part of making sure that the client's well-being is intact before leaving the session. Lastly is Phase 7 and 8. Phase 7 is the close of the session, which is complete or incomplete reprocessing, determining if the memory has been completely processed or not. Phase 8 is the follow-up for every session that includes feedback on the experience and then reevaluating that target memory to see if it has been completely reprocessed enough to move on to the next one. If not, it can be revisited in the next session to keep moving forward to reprocess it correctly. As previously mentioned, the importance of the therapeutic relationship in EMDR must be addressed. Adaptive memory networks must be present for reprocessing to occur. Things such as speech, rhythm, and eye contact are crucial for rapport and safety. Being able to perceive client signals and being aware not to intrude is also something that the therapist must be aware of. They must also react appropriately and promptly to the client. The speech and tone of speech helps to elicit cognition and giving verbal support during the set. Rhythm means the bilateral stimulation and timing of sets and breaks must be balanced and appropriate for the client. Eye contact is being aware of facial expressions and the eye movements of the individual. Perception of the client is being able to address their awareness during bilateral stimulation and ensuring their safety. Not misinterpreting is refraining from making comments and staying out of the way during the reprocessing. It is important for the therapist to not add in their own comments or make noises during the process, as this can disturb or hinder the process. Being prompt and appropriate is keeping the client in stimulation and reacting promptly to effective stress of the client. If a client appears to be in stress, it must be addressed and stopped by the therapist to ensure the well-being of the client comes first. EMDR can easily fit into a Christian worldview. EMDR works to reduce negative cognition the client has and turn it to a positive one. The negative cognition can be seen as the lies that we are told and believe from Satan through his attempt to make us feel powerless and worthless. The positive cognition is what we know to be true about ourselves and from God and His Word to us. God's grace is ultimately the only thing that is sufficient to help heal and break the bonds that trauma can cause in our clients' lives. This then allows our clients to reframe their suffering and allows meaningful work to come from it, according to God's plan. Now we will take a look at how EMDR and internal family systems combine together throughout the phases of EMDR. Phases 1 and 2. During Phase 1, we can utilize parts during the history-taking phase to assist dysregulated clients to be able to process traumatic material. The therapist contracts with the parts that emerge here and become curious about them. The client self will witness the part and work to connect with external triggers through the EMDR process. IFS helps to stabilize the client and organize the sense of self, making sense of external experiences and reprocessing them. During phase 2, the identification of self can assist with target development of EMDR. By befriending the parts, the client can create the healing process of unburdening and working to settle the parts and let the true self come forward. Protective parts can sometimes block the access to traumatic wounds, which is where IFS and EMDR can be utilized together to promote deeper healing. EMDR can assist with helping to unblock the protective parts and to dig deeper into the traumatic wounds to heal them. Phases 3 through 5 in EMDR help to begin working towards recognizing the parts and giving them a voice to express their needs within the internal family systems. Doing this requires careful consideration of IFS preparation, as this can assist with identifying the target memories and core components of these memories that need to be reprocessed. Sometimes, despite verbalizing readiness to proceed, managers or the firefighters that an individual has may come to the surface and interfere with the EMDR process. This is when IFS can help to settle those parts down and allow EMDR to work. Sometimes EMDR can actually override these parts and expose the exiles that the client may not be ready to yet handle. This is why it's important to ensure the readiness of the client and help them to have coping skills to deal if the exiles come up. This can result in the client retreating from therapy, disengaging, disassociating, or allowing the firefighters to cover and cope with negative behaviors, such as risk-taking or addictions. Phases 6 through 8. IFS education can continue to enhance a client's positive resourcing and resilience. Finding and nurturing the self can be utilized in the desensitization and installation phases. This allows for EMDR to help the self to surface and the other parts to retreat and become less present. During the body scan, the client can connect any residual feelings with somatic experiences of these certain parts, so they can determine which parts are still present and causing them feelings and experiences after the EMDR process. Creating gentle and warm therapeutic approach can ultimately lead to the client to a place of healing and self-compassion where the true self is taking over. The final approach that I will be integrating into my trauma treatment is art therapy. Art therapy integrates nonverbal communication through visual narratives that allow for active and creative self-expression. This allows clients to identify, externalize, and process the psychological and physiological effects of trauma by engaging in the creative process. Trauma can often be coded in smells, visual images, and sounds. Art therapy can help to process the sensory decoding of these traumatic events in these different areas. Art therapy has also proved positive health effects when utilized with clients who have PTSD. There are 5 art therapy factors that are most relevant when treating someone with PTSD. These factors are concretization, symbolism and metaphors, tactile and sensory exploration, emotion processing and regulation, perspective taking and reframing, and the therapeutic alliance. Concretization, symbolism, and metaphor. The use of symbolism, metaphors, and concrete representation of abstract content into tangible forms is a unique factor in creative art therapy. This allows for expression and processing of emotions, thoughts, and ideas through imagery onto a concrete form. Metaphors and symbols can also allow for insights into the self and others. Clients with PTSD have reported that art therapy allows for the communication of inner experiences and visual self-narratives through the metaphors and symbols. It allows for them to be creative when getting out how they're feeling and the thoughts around their symptoms, and the traumatic event without necessarily having to exactly say what they're feeling. Tactile and sensory exploration. Various art materials on a continuum. There is structured art media, such as markers and colored pencils, and then there's fluid art media, such as pastels and paints. Visual and perceptual systems of the brain are involved. Different parts of the brain have been shown to be involved, depending on the different types of art media being used within the activity. The goal is to shift from a maladaptive to adaptive responses within the client. It also involves an active kinesthetic component. Haptic and proprioceptive visual sensations are engaged and worked through to be better enhanced within the client. Picking the materials for the client to use can be an important step in opening up different parts of their brain and memories to be able to explore them deeper. Emotion, processing, and regulation. Art therapy includes projecting and expressing emotions that can help guide treatment goals. It helps to facilitate trauma recall, access to emotions, and enhance the self. Sometimes art therapy is a way that the clients can get out the feelings and thoughts that they have about the traumatic experience when they're unable to speak them. Emotion processing and regulation can be activated by different art mediums and materials. Again, this goes back to the perceptive of the art media being used and which part of the brain that it activates. Art making can decrease the parasympathetic reactivity irregardless of the materials. So whether they're using markers or color pencils or pastels or paint, it all helps to decrease the parasympathetic system reactivity while helping to regulate their emotions in different ways. This ultimately can also help to reduce anxiety and cortisol levels within the individual. Perspective taking and reframing. Art making can help to promote perspective taking and enhance self awareness through reflection. It allows for a visual and creative way to get out their perspective of the traumatic event and enhance the self awareness around it. It helps the clients to also be able to clarify their feelings and thoughts regarding the traumatic event. It can allow for changing distressing images and memories and symptoms that can interfere with the client's functioning. Mindfulness-based art therapy can also assist with stress reduction and improve relaxation, self-management, exposure, and cognitive change. This goes back as well to the emotion processing of reducing the anxiety and cortisol levels when using art therapy. As with any therapeutic approach, the therapeutic alliance is proven to promote safety within the relationship, which ultimately leads to emotional release and positive change. There are 3 different types of therapeutic alliances that the therapist can engage in as a role. The non-directive therapist behavior follows the client and facilitates the client. The client is allowed to lead of the sessions and their treatment, where the therapist just kind of goes alongside of them, guiding them and directing them as needed. The directive behavior is active and leading the client. This is where the therapist takes an active role and leads the client in the direction that they should go and into their healing. An eclectic behavior is a mix of non-directive and directive. Determining which behavior a therapist should take with a client depends on the client and what their needs and goals are for treatment. Art therapy and Christianity. Art therapy can be utilized to deeply explore the client's relationship with God. They can express feelings, emotions, and even the pains that they feel, not only through the traumatic event, but also with their relationship with God through the event. Similar to writing it down, art therapy can be utilized to express prayer and gratitude or even lamenting to God. Not only can art therapy be utilized to address mental and emotional well-being, but it can also address spiritual well-being as well. Art therapy is compatible with Christianity and all types of spirituality, as it allows for a creative expression of one's thankfulness, lamenting, or even anger towards the traumatic event, and for God allowing it to happen, or to work through that and then express how God has used them and their event to shape their lives and turn them into who He has called them to be. Art therapy can also be integrated into the internal family systems. It can help to externalize the parts through creative means. This can be done through drawing out the parts and their feelings, and even putting colors and sensations through creative arts to the parts. This then can also be used to show how the parts decrease and how the self increases over time through the therapy. Art therapy can be utilized in the different stages of IFS by helping to physically show the different parts, their roles, and then over time how they decrease and how the self increases in the individual. In conclusion, internal family systems and art therapy can be utilized within EMDR for the ultimate healing of trauma in clients. IFS is the root of the therapy that is then integrated into EMDR and art therapy, both separately or incorporated together as necessary for the client to process and heal through the traumatic experience. This is my personal integrated theory approach that I would like to use one day when I get to work more with individuals who have experienced trauma.